Netsmart versus Behave Health is one of the most consequential decisions an operator can make. The platform you pick touches everything: admissions, clinical documentation, billing, and alumni follow-up. These two platforms take very different approaches. One is an enterprise EHR suite. The other is an all-in-one system built for treatment centers. We compare them across CRM, clinical documentation, revenue cycle, and the operational tools that run your facility. First, who each one is built for. They target very different segments of behavioral health. Netsmart is an enterprise EHR vendor selling into large health systems, community behavioral health centers, and state-funded organizations, with products that appear to include My Avatar and My Evolve. Behave Health is purpose-built for treatment centers and programs that need to move fast without enterprise overhead. It supports the full continuum of care without requiring dedicated IT staff or year-long implementations. Here is what is at stake. In behavioral health, speed to admission decides whether someone enters treatment. Delays of even a few hours can mean a lost patient, and an enterprise EHR built for large systems can add unnecessary complexity. Enterprise implementations can extend over many months and carry costs that are prohibitive for a standalone treatment center. So where do they actually differ? 4 areas separate them. Let us walk through all 4. Admissions, clinical documentation, revenue cycle, and operations. 1. Admissions and lead management. Netsmart centers on large-scale intake from government and managed care referral networks. It is not a dedicated admissions CRM. Behave Health is built for speed. Online applications, instant verification of benefits during the call, lead and referral tracking, and census management. A record created during the inquiry flows straight into documentation and billing, with no duplicate data entry between modules. 2. Clinical documentation and treatment planning. Netsmart's My Avatar and My Evolve cover documentation and treatment planning, but enterprise tooling typically means extensive configuration and a longer learning curve. Behave Health is designed around behavioral health workflows, ASAM criteria assessments, COWS and SIWA scoring, and group therapy notes with attendance tracking. Plus, e-prescribing via Doctor First with EPCS, integrated drug testing, and outcomes tracking using validated instruments and NAATP Force. 3. Revenue cycle and billing. Netsmart's billing is oriented toward Medicaid, Medicare, and state-funded programs. Private pay and commercial utilization review are not the apparent focus. Behave Health's RCM is integrated into the clinical workflow, eligibility verification, claims submission, ERA and EOB processing, and denial management. When the treatment plan, utilization review, and claim reference the same patient data, the risk of gaps that lead to denials drops significantly. 4. The operational layer outside the clinical record. This may be the biggest difference of all. Treatment centers manage properties, vehicles, maintenance, and staff credentials. Enterprise EHRs, including Netsmart, do not typically appear to include these tools. Behave Health includes an ERP layer, property management, human resources and credentialing, vehicle coordination, and maintenance scheduling. It is designed to consolidate operations alongside clinical and financial workflows instead of a patchwork of spreadsheets and separate software. Here is the payoff of one unified system instead of separate modules. Behave Health is designed for rapid deployment. Many organizations go live in weeks rather than months. The all-in-one architecture means there are no separate modules to integrate and no complex interoperability layers to manage. CRM, EHR, RCM, and ERP live in a single integrated platform with no requirement for dedicated IT staff to maintain it. And if you already run Netsmart and are weighing whether to switch, the move is structured. Behave Health provides a structured migration path for current Netsmart users evaluating a change. The team handles data migration, staff training, and parallel go-live support. It is designed so the transition does not disrupt your operations or your revenue cycle. Stop letting enterprise complexities slow your admissions. See how an all-in-one platform compares end-to-end at behavehealth.com. See admissions, documentation, billing, and operations in one platform. Book a 20-minute demo at behavehealth.com.